I'd like to call to order the Board of Supervisors Health Committee meeting for Monday, November 24th. We're going to start with a revised ordinance on e-cigarettes.
Good morning. So we're here just to talk a little bit about the revised ordinance on electronic smoking devices in Alameda County. Just an update since the last time we met. We've had 4 cities actually implement their own ordinances, and that's Dublin, Berkeley, El Cerrito, and Piedmont. And in each of those, they included electronic smoking devices being defined as tobacco products. Since that time, we've also had a couple of articles come out in terms of the impact of the vapor and electronic smoking devices, and the devices are actually changing over time, becoming more powerful in terms of the amount of vapor that they produce. There are some sources of third-hand exposure to nicotine, meaning it sits in the environment in places where they are used, in addition to ongoing information about the new products coming out and actually producing more formaldehyde than the older products in terms of that. So there's still some research coming up in terms of the negative impacts that can come from electronic smoking devices, so we still move forward.
And with respect to the ordinance itself, since the last time we appeared in front of Health Committee, the most significant change is we had previously separately defined electronic cigarettes, electronic smoking devices, and so anywhere within our ordinance where there was a regulation on tobacco products, we would say, and electronic smoking devices. The effect is the same with what we've done, except we've also included electronic smoking devices within the definition of tobacco products. So there's no longer separate tracks. That was done at the request of several organizations in order to align our ordinance with what's happening at the federal level.
Okay. In terms of this change that we're making, the cities that passed it, did they do it like that, or did they have it did they have it separate?
It's the understanding that it's included as tobacco, so it's not separate.
So all the other cities who did it included it as a tobacco product?
Yes.
Okay. All right. We have a couple speakers, Randy Rogers and Ben Jewell.
I actually have a couple of pages I'd like to give you guys. Thank you. So the paper I've handed each of you shows 2 different studies done on the effects of electronic cigarettes, both to the person using and to the secondhand effects. Both studies show that the amount of carcinogens and chemicals found in both the inhaled and exhaled vapor were insignificant, almost unmeasurable, and far below the allowed amount by the USDA. This is a propaganda campaign that's going on here. They're demonizing vapor and nicotine. I think the next step would just be release Vapor Madness, probably coming into theaters next year. Every time there is an opposition against the vapor, nicotine, the carcinogens, whatever it is, they're very vague. They never show exact numbers. They never show real science. And it's just a scare tactic. And now they're using a domino effect to pass this ordinance in many different counties. I oppose the ordinance, and I think that we need to look at it with a panel of experts and really go through and make sure that what we're doing is right. We cannot clump it together with a tobacco product. Tobacco products are old. This is new technology, and it's a whole new item that we need to handle appropriately. If we do make vaporizing harder or demonize it, we're only promoting smoking cigarettes, and that's going to lead to millions more dying. We have a golden opportunity here to do something right, and we need to do that, Just because everybody else is making the wrong decisions does not mean we need to jump off that cliff with them. Thank you.
Can you just tell me who funds Utah Vapors?
I do not know who funds Utah Vapors. I'm sure I could do a little bit of investigating and find that out. I did find that Johnson & Johnson Pharmaceuticals funds Change Lab Solutions, who basically wrote this ordinance. And Johnson & Johnson's are the one that make the patch, the gum. So there's a clear trail leading back to who's paying for this.
Okay, I would like to know the trail on who pays for Utah Vapors and the Clear Stream Air project as well.
Can I get your email address?
You can just send it into the 5th floor here and I'll get it.
Cool, I will do that, thank you.
9,000 observations you did?
What's that?
The 9,000 observations that you did, how did those take place?
You know, the whole study I didn't print out for you guys because I wanted to keep it short and sweet so you guys can see
But
it.
just basically, what were the steps you went through for the 9,000? Were they 9,000 individuals, an individual testing of vapor? What it actually?
Oh yeah, they did it on individuals. They did it on what products they were using. They did it on what items they were measuring coming out of those products. So I would suspect that a combination of those were the 9,000.
So you're referencing it. Do you know in detail what exactly took place?
When I was looking at the study, I read through quite a bit, yes.
In terms of the 9,000 observations about the chemistry?
No.
Okay, thank you.
Mm-hmm.
While the next speaker is coming up, Dr. Davis, can you talk about some of the points he made in terms of the harm of the vapors?
So there are a couple of things that are unknown in this, and this is where, because it's such a new product, things are changing. What we're starting to see is that the electronic smoking devices are actually getting bigger. They're tank systems that are actually producing more vapor, so there's more concentration, more quantity of the chemicals that are bad in that. And that's, again, sort of an unregulated product and an unregulated mix of chemicals and flavors. In this, what we're seeing with those in particular studies that talked about the level of formaldehyde that gets produced in it is about the same as with cigarettes. In terms of the third-hand exposure, that's a discussion of nicotine remaining in the environment with the products that are there, and those are studies in relationship to that. They have done some studies in relationship to both direct and indirect exposure from the chemicals that are produced, and even with the indirect, meaning what's passively taken up by a person who's not actively using the product, there are still chemicals that are above what would be expected to be normal in terms of that, and those are harmful, and that includes nicotine in addition to propylene glycol. Again, which still is approved by the FDA as a food additive, but not necessarily something to be inhaled and so, or vaporized, whatever you want to call it. So there are studies that do look at the exposure in terms of that, and that's more and more is coming out about that.
Thank you. Okay. The next. Were you Ben or were you Randy? Oh, you're Randy. Okay, Ben.
From the body parts groups that are going to turn in their slip slate, they like to get the last word. But good morning. My name is Ben Jewell, and I'm the owner and operator of Ready Set Vape in Castro Valley. I rise today to urge you to take a hard look at the people who are pressuring you to do this ordinance. It's the body part groups. It's the ALA, the ACA, and these guys are funded in large part by pharmaceutical companies, by Pfizer, by Johnson & Johnson. There is no public health concern here. What there is a profit concern. And I'll just continue. What they really want out of this ordinance is the equivalency and nothing else. If you guys go back to dual track, they will not support it. They've already shown that with Corbett's bill earlier in the year. So when they switched to a parallel track definition on 648 earlier in the year, they rose an objection to it, and the state lawmakers really started yelling at them. It was pretty funny. So just follow the money back. It's really, there is no public health concern. This is not smoking. There's no smoke created. You're saying that there's dangerous chemicals, yes, but do they rise to a level of concern, of health concern? Or is it detectable, right? Those are two different things. And I look forward to more of this debate, definitely. Thank you. Any questions?
Okay, Serena Chen and Brian Davis.
Good morning, members of the committee. My name is Serena Chen. I'm with the American Lung Association. And basically, I've been working on tobacco control for the past 25 years. Our goal is to prevent lung disease and to support public health efforts to do that. The electronic cigarette industry argued to the FDA that they were a tobacco product in 2008 and 2009. The reason why they did that is because the FDA looked at the product and decided that it was a medical, what is it? A drug delivery device. Thank you. A drug delivery device. The electronic cigarette industry said, no, this is not a drug delivery device. This is a tobacco product. So basically, they won in court, and the FDA appealed because they still felt that it was a drug delivery device, and they lost in court. So a federal judge ruled that it should be regulated as a tobacco product. All we're doing is saying the electronic cigarette industry argued that it was a tobacco product and not an electronic smoking device, and not a medical device. And so basically, it's what the federal judges have ruled twice, that it should be regulated by the FDA as a tobacco product. Having said that, the FDA is now going through the process. They've submitted how it should be regulated, but actually local communities and states need to regulate where it's being used. And the studies have shown, there are different studies, as Ben has said. There are studies that say that it's harmless, and there are studies that are measuring formaldehyde and other toxins. Having fought against the tobacco industry for 25 years, it's hard for me to believe the other. So basically, I wanted to share with you something that does not come from public health at all. It's from the ASHRA, which are the indoor quality engineers who look at air quality in buildings. These are people who care about the air quality in buildings, not from a necessarily public health perspective, but how buildings are run. And they produced a column on the hazards of e-cigarettes, in which they've looked at all the published articles about it, and they have found that it should be regulated indoors. So this is not from the public health point of view. Also, I just wanted to mention that Change Lab Solutions might be getting some grants from Johnson & Johnson, but basically they're funded by the tobacco tax, and they are tasked with, again, protecting the public health. And that's all I have to say. When I first started working in tobacco control, we had to fight the Federal Cigarette Labeling Act, and that labeling act was written 20 years previously, which prevented communities from addressing advertising in tobacco. And we know that the tobacco industry has a very forward game. They know 20 years in advance what they need to do. So the separation of e-cigarettes from a tobacco product is exactly that kind of game in which they're looking forward to see how they can undermine public health in the future. And here's the summary of UCSF researchers looked at a combination of all the studies that have been done so far as of May. And you can see the evolution of these smoking devices here. And the bottom ones, the tanks, actually have been shown to emit as much formaldehyde as a regular cigarette. Thank you.
Brian Davis.
Good morning. I don't have a prepared speech, so I'm just going to sort of talk about what I've been working on and what I'm aware of. I've noticed that This legislation will add e-cigarettes to the sampling law and the giving away of the current ban on giving away of e-cigarette free conventional tobacco products. And it is becoming more and more common to see the free distribution of e-cigarette products in the communities. I've seen it and I'm aware of it in many communities in the Bay Area. And so this is not a good thing that these are being given out for free when we've got young people and we've got higher levels of, I believe it's over 250,000 young people nationally, middle and high school students who are using electronic cigarettes who have never, ever used a conventional cigarette or conventional tobacco product. And that is really scary. A lot of these kids think that there are no nicotine in these devices. They're getting hooked on nicotine without ever using a conventional cigarette. And this is the kind of thing that we need to be watching out for. And if we know that these are being given out for free, you know, the first one's always free, right? These are drug pushers that we're talking about here. We know that Big Tobacco owns a lot of these e-cigarette companies, and especially the ones that are heavily advertised. And it's really necessary to be protecting the health of our young people, doing everything we can to reduce the availability of these e-cigarette, nicotine delivery devices, which is what they are. We just need to be careful. We need to be watchful. We need to be doing everything we can to protect the health of our young people. And it's just a sensible action to take. That is what you are proposing here today. So thank you very much.
Okay. Are there any other speakers on this item? Okay. This, I understand. Did you? Okay. On this one? Okay. You can come up and talk first, and then.
Okay. Good morning. My name is Marlene Hurd, and I'm requesting that you support the ordinance. Right now, I'm the president for the Tobacco-Less Club at Merritt College, and we are working with Paul Cummings, the California Department of Public Health, in reducing tobacco control on our campuses, 4 campuses. 2 weeks ago, I encountered electronic cigarettes, got into my chest, and my chest hasn't been right since. And I want to let you know that our college students, we do want to protect their health, but we also want to protect the health of the public, our campuses, and our children. It was a little scary for me when I encountered the secondhand smoke, realizing it was electronic cigarettes, and that's why I'm here today. But most importantly, as the gentleman just said, we want to protect our youth. They're picking up the secondhand smoke and using the electronic cigarettes as a way to not smoke. But when you think about it, it's harming them even more than the secondhand smoke is. So I urge you to support the ordinance and appreciate that you have even considered doing this. Thank you.
Okay, anyone else on this topic?
So, Brian,
Okay.
if I can make one quick comment.
Yes.
So there was a comment in terms of what levels the things were being measured at, and the levels that they're being measured at is a level above a health risk. So what I mentioned before were not about being detectable, but about the level of being a health risk, and that was in particular for passive folks being exposed. So.
Okay, so what happens now is we had heard this ordinance before. It's been revised slightly. A couple of supervisors want to bring this out to their districts, and then it'll come back to the Board of Supervisors for a vote.